हेलो एवरीबॉडी वेलकम बैक सो आज हम बात करने वाले हैं अबाउट कोरोना वायरस Honestly, I think I don't need to give any introduction about COVID-19 because all of us obviously have researched enough and Googled enough about the virus, but still a little bit of introduction. So we know that coronavirus is a very infectious virus, and the primary source or method in which it can spread is if we come in exposure to with anybody who is infected and in exposure with the droplets or the discharge from that person's cough or sneeze. So let's talk about people who are at risk to get infected. So ये हम सबको पता है that the virus is not age bound. ये किसी को भी हो सकता है, it can infect anybody. But still, people who are aged, like the geriatric population, older people, if anybody is already suffering from any medical condition, people who have cardiovascular disease and the history, anybody who is suffering from cancer, if you have any respiratory problem, pregnant women or newborn children, these people are still at a higher risk to get infected from the serious illness. So the primary symptoms of this virus are fever, sore throat, cough and headaches. In severe cases, the patient is going to develop difficulty in breathing and it can also prove fatal. So basically the virus shows a range of symptoms ranging from mild illness to something like pneumonia, and most of the people infected from COVID-19 virus are going to experience respiratory illness. So respiratory illness and the rehabilitation of the person who is already infected is where the role of a physiotherapist is going to come into consideration. So today we have with us Dr. Varun Nayak, who is going to enlighten us with his knowledge about the role of PT in COVID-19 rehabilitation. He will be talking about what a patient should do when he is already infected by the virus and what he can do post-recovery. Many of the patients were unable to be hospitalized, so he will also be talking about the techniques and exercises the patient can do at home if he is infected and post-recovery. So basically, he's going to help us understand and increase our knowledge about how patients can just cope up with their respiratory problems and how they can improve their breathing pattern and their lung capacities. So thank you so much, sir, and over to you.
Hello everyone. As we enter lockdown 4.0 and the cases of COVID-19 are increasing around the globe, there is a need to understand the physiotherapy treatment for the same. I would like to address the recommendations and precautions to be taken while treating a COVID-19 patient. I, Dr. Varun Nayak, Assistant Professor and Consulting Physiotherapist at Keli's Dr. Prabhakar Kore Hospital and Medical Research Center, Belagavi, would like to address the same. Individuals of COVID-19 present with influenza-like symptoms demonstrating fever in 89% cases, cough in 68% cases, fatigue in 38%, sputum in 34% and shortness of breath in 19% cases. The current reports are suggestive that 80% of cases are asymptomatic and the other 15% are severe, which require oxygen administration, and remaining 5% are critical, requiring life support or ventilator. The current mortality status indicates a range of 3 to 5%, wherein newer reports are emerging which are suggestive of 9%.
In this lockdown 4.0, improving the functional status of the lung and the body solely depends on improving the physical activity of an individual. Now, improving the physical activity can be based upon so many ways. The first one being incorporating 30 minutes of exercises in your entire day. The exercises which are believed to be useful are basically your aerobic exercises such as low intensity exercises, general mobility exercises, walking, provided these exercises are done within the limits of quarantine. Coming back to the other symptoms of COVID-19, which has one important component as shortness of breath or dyspnea, as we call it as in medical terminology, can be very well managed with physiotherapy interventions like using the dyspnea relieving positions like leaning over the wall, leaning over the pillow. These all positions are effective. Dyspnea usually is caused by hypoxia, and to minimize the effect of hypoxia we can very well utilize another position, that is the side lying position. The side lying position always helps in reducing the collapse of the lung as well as to prevent the effects of hypoxia. When speaking about hypoxia leads to decreased in thoracic mobility. In decreased thoracic mobility, the physiotherapeutic intervention basically used is butterfly exercise. In butterfly exercises, you need to expand or open up your entire chest while you inhale or you breathe in the air through your nose and breathe out through your mouth. Breathing out through your mouth helps in reducing the entire collapse of the lung.
Coming to the recommendations for physiotherapists who are treating COVID-19 cases, the first and foremost being droplet transmission precautions, which can be done using surgical mask, then gloves, fluid resistant full sleeved gloves, goggles or face shield, personalized protective equipments, hair cover and shoes that are impermeable to fluids is advised. Second recommendation being use of positioning in clearing of secretions. As gravity is assisted and minimum contact of physiotherapist is achieved in postural drainage as well as in position. The third recommendation being suggested by WHO, in which 30 minutes of regular physical activity helps in minimizing the decline in functional status as well as decreasing the risk of ICU acquired weakness in the cases of COVID-19.
So the best way to prevent and slow down transmission is to be very well informed about the COVID-19 virus. Please protect yourself and others. Keep washing your hands regularly. Use an alcohol-based sanitizer frequently and avoid touching your face as much as possible. Even if you want to cough, please follow the respiratory etiquette of coughing directly into your flexed elbow. Do not cough on your hands directly, so that even if you touch something by mistake, you are not spreading some infection. Use tissues while coughing and sneezing, and you can dispose them off properly. Masks and gloves are very mandatory. Even if you're using them, please make sure you use them properly and dispose them properly. Please make sure you're covering your face properly, and while using a mask, also use a hand sanitizer so that you can frequently sanitize your hands if by chance you touch your mask. And lastly, one special request, please do not believe on messages that are forwarded on WhatsApp unless they are verified. Please make sure that the news and anything you read is from a very trustworthy source. So please do not forward anything just like that. Please read them properly, and we don't need to be scared. We are all in this together. So please remember that. And lastly, I would like to thank Dr. Varun Nayak sir for taking out time for us and giving us such insightful information. Thank you so much, sir, and we wish to reconnect with you on many different topics soon. And lastly, guys, relieve your pain, regain your life.